Good afternoon, everyone. This is County Executive Pat Ryan. Thank you for tuning in for our now regular COVID-19 update. In particular, given the growing risk and level of community transmission of the Delta variant, we're going to continue to provide regular updates and, frankly, continue to take additional precautions as needed to make sure we maintain public health and public safety as we now tackle yet another wave of this part of the COVID-19 pandemic. At the top level, to cut right to the chase, the Delta wave of COVID continues to accelerate, continues to build momentum, and we must step up our game to match the continued health risk and the growing health risk from the Delta variant in particular. So once again, I'm going to talk about the numbers and the data and where we stand in Ulster County, and then outline some of the additional precautions and steps that we're taking. This is yet another series of additional public safety and public health measures, really looking at the data, assessing the situation each day. And as we see COVID continue to get worse, unfortunately, we must remain proactive and do everything that we can to stay ahead of this growing Delta wave. So starting with the numbers and the data, I'm actually going to start with one of our charts. This is looking back over the entire course of the pandemic, going back to the early days of March of 2020 up to the present. And we can now very clearly and strikingly see this Delta wave building momentum, growing increasingly steep curve, and seeing the number of active cases. This is the active case graph in Ulster County. Of course, at the worst peak, we were above 2,000 active cases, but we are quickly approaching and have been hovering around 600 active cases, which is a significant escalation from where we were just a few weeks ago. And most concerning is the momentum with which that active case count continues to grow. Right now in Ulster County, we're at 576 active COVID-19 cases. The positivity rate has now, on a 7-day moving average, is 6.2%, very high. And over the last 24 hours, even higher, 6.85%. So the combination of a growing active case count and a very high positivity rate means that things are headed in a bad direction, and we're going to continue to see that that steep climb grow unless we can change the dynamics on the ground and take additional precautions. Unfortunately, we also have to report one additional fatality in the last 24 hours, bringing us to 274 fatalities in Ulster County. One other measure that I think is very important, the reminder of what is driving the increased positivity. We know in the data that we are getting from New York State and nationally that it is almost 100% of the new cases that are being sampled and tested are Delta variants. And there's even growing concerns about additional variants that could emerge from other parts of the world. But we know that because of the much more contagious nature of Delta variant, it's essentially surpassed all the other COVID variants and is now the dominant strain here in Ulster County, in New York State, and pretty much across the country. The good news is that we continue to see our vaccines, our COVID-19 vaccines of all types, work very effectively, not 100%, but very, very effectively against even the Delta variant, which is the good news, and more reason to get vaccinated if folks haven't already. The breakthrough numbers that I wanted to share, this is as of today, going back to April of 2021. Since we began vaccines, we've had 540 total breakthrough cases in Ulster County. That's out of 123,000 plus vaccinated. Once again, that's putting us at about 0.4 to 0.5% of total vaccinated folks breakthrough cases. So the breakthrough numbers remain very, very low. So even with significant transmission of Delta, the vaccine is doing its job and working very well. And that is really important to take note of. We have a lot more work, though, to do on our vaccinations. We currently have in Ulster County 123,154 county residents vaccinated with at least their first dose. That puts us at 78.9% of adults 18 plus, which is right around the state average. We had been ahead of the state average. Now we're right around the same. And that's 69% of all residents of all ages in terms of our total vaccination progress. So we have more work to do there. Given the continued health and safety risks, I'm going to announce 2 additional significant steps and precautions based on consultation with our health commissioner, Dr. Smith, who throughout the pandemic has been just absolutely critical for myself and all of us to lean on her expertise and her advice. Later today, she will be issuing a updated set of guidance for all Ulster County residents based on her public health expertise and really reiterating the federal CDC guidelines that will strongly recommend that all residents wear masks when indoors. Once again, this is based on the high level of community transmission of COVID due to the Delta variant. And this is another escalating step in the recommended precautions from Ulster County Health Commissioner Dr. Carol Smith, strongly recommending that all residents, regardless of vaccination status, wear masks indoors where we know there's much higher risk of transmission. This is a key step to make sure that we can slow and ultimately stop the spread of the Delta variant while we buy ourselves time to up our vaccines percentage and also hopefully prevent any additional variants that could be even more dangerous and more contagious and or resistant to the vaccine. The second step that we've taken as a county is to further up our safety protocols for the protection of our workforce and the public. I signed an executive order earlier today directing that all county employees, regardless of vaccination status, and all visitors and residents entering any county buildings and facilities must wear masks at all times. Previously, we had only required this for unvaccinated residents. Unfortunately, because of the spread of transmission of Delta, which to be clear is almost exclusively due to unvaccinated residents, because of that, we now all have to wear masks. I want to be very clear about this. This is a large set of our population who have done the right things, who have been vaccinated, but because too many folks have not been vaccinated yet, we're all paying the price for that. We're having to escalate our safety protocols. And I know that's frustrating to everyone, but unfortunately that is where we're at. And as a county, throughout the pandemic, we have led by example. We're going to do that again here. And as a employer and as an important part of the community, we'll be taking these extra precautions again, requiring all county employees and all residents entering county buildings to wear masks indoors for everyone's safety. I'd encourage other organizations, businesses, not-for-profits to do the same. Of course, we've already put out our guidelines for schools requiring masks for all and encouraging testing for unvaccinated folks. So we are following that same protocol as well now as a county team in Ulster County. Once again, the long-term solution to ultimately fight back COVID and Delta variant and any future variants is the vaccine. And we're in a race to get enough folks vaccinated to quell the Delta variant and to get ahead of and remain ahead of any other variants that might emerge. Along those lines, we're continuing to up our game with vaccination efforts. We have our county pod site reactivated at the Kingston Plaza, right next to Savona's Plaza Pizza and in the former Payless location there. So that is active Fridays from 2 to 7 p.m. We've had a good flow through there. We can add more capability there if needed. And most importantly, looking ahead to September, which is just a few weeks away now, as boosters become available, excuse me. As boosters become available, we will be reactivating our Hudson Valley Mall pod site, which lets us vaccinate thousands of folks a day at full capacity, so that when folks are eligible for that second or third, mostly third booster shot, we'll be able to meet that demand. We'll also be working with the state to hopefully bring to bear state vaccination resources as that booster effort ramps up. I'm confident and comfortable in our planning right now that we'll be able to get those boosters out as quickly as possible. That won't mean that everybody gets it day one, but it means that in a pretty rapid manner, we'll be able to get booster shots out to everybody that wants them, who have received their first and second doses. So again, that's the main updates in terms of where we stand with COVID in Ulster County. We continue to update our COVID-19 dashboard. I know we did have a slight window there where it hadn't been updated yesterday, so I apologize for that, and we'll tighten that up. You can see real-time data there for the last 24 hours and going back. And once again, I just thank everyone in advance for their understanding. I know we've been through a first wave that was extremely difficult, a second wave that was even worse. And the last thing we wanted coming out of the summer into the fall with schools reopening was to have to deal with this again. Unfortunately, that is where we are. The data and the facts are very clear. The consensus from all health experts is very clear. So we're continuing to let the facts on the ground and the data drive our decisions and taking precautions carefully, thoughtfully, based on the science and the data to keep everyone safe. Once again, I want to reiterate Dr. Smith's recommendation to all county residents that when you're indoors, which is more risky, that you do wear masks. As I said in our last update, I have started to do that as well. And of course, we've now mandated it within county facilities. I appreciate everyone's continued patience, continued awareness that what each of us does individually affects, of course, our family and our loved ones and those we come into direct contact with, but affects our most vulnerable residents. And I don't want to lose sight of that. I think about the family of that individual that just passed in the last 24 hours, that county resident, and how they must feel that loss. Now bringing that to 274 families that have lost someone to this, and of course, hundreds of thousands across the country. We can't lose sight of the life and death consequences of the decisions that we have to make, while not ideal, are necessary to keep us all safe. So thank you. We'll continue to keep everyone updated. In the meantime, please reach out if you need anything. You can call our Recovery Service Center by phone. That is 845-443-8888. You can go on our COVID-19 webpage, which is covid19.ulstercountyny.gov, or you can go to vaccinateulster.com for all information about vaccines. And really, that'll link you into any of the other data and information you might need. Please spread the word and encourage others to up their game as well. Once again, as the Delta wave continues to build and accelerate, we have to step up our game. That's what we're doing here in the county, and we'll continue to do so. In the meantime, stay safe and healthy, and let's stay resilient through this, and we will see you soon. Thanks.